Hi, everyone. My name is Dr. Noor. I'm a health insurance expert. I live in Tampa, Florida, but I work with clients all over the nation. And I love talking about health insurance, even though it's a very boring and unsexy topic. Like to think that I make it exciting and I get excited about it. So I like it when my clients get excited about it. I'd like to start off with introducing myself and kind of sharing my story and my journey on how I got from medicine to health insurance because that's something that I get asked a lot. My background is actually internal medicine and general surgery. I went to medical school abroad in Bangladesh. So I'll share how I went from medicine to health insurance. And the story really starts when I am 5 years old and I'm sitting on my grandfather's lap. We're reading our favorite book together. It's actually Gray's Anatomy. It's the number one anatomy textbook for medical students worldwide. I've got hearts in my eyes as I look up at him. He looks down at me and says, "You're going to be a doctor someday, just like me, aren't you?" Yes, Dada, yes, I am. And the wheels are in motion. From then on, I was on a fast track trajectory propelled into a career of medicine. In middle school, I was taking high school courses. In high school, I was done taking all of my college courses. I'm 18 years old, living in the Big Apple, and I'm about to start my college career when I get a phone call. Hello? Dada's died. What? My father looks at us and says, "We all have to move back to Bangladesh now." Before I know it, I'm standing in 118 degrees of sweltering heat. And this time I am clutching my very own Grey's Anatomy as I'm standing in my medical school college campus. I'm walking across the campus trying to get to my class and I'm tripping over chickens and goats. Dada, where are you? Where am I? What is this? If I were in New York City, I would have been eating this chicken off a halal chicken and rice cart. My world was upside down. I was skinny. I couldn't eat the food. I couldn't communicate with my peers. I was struggling just to survive. The only thing that gave me comfort during that time was my education. So I dive in deep. One of my professors recognizes my ambition and says, "Hey, you're really good at surgery. You just timed 16 minutes and 30 seconds for the C-section. No one's ever done that before." I was on a roll. During my free time, I founded an international award-winning community project that was recognized by the United Nations. I was offering free antenatal care to pregnant women across slums all across Bangladesh. The project was awarded on an international stage in 2014 by the UN. I'm 23 years old in my final year of medical school, and love is the last thing on my mind. A man I met 6 years earlier finds me halfway across the globe and we really hit it off. He asked my father if we can go on a date. Sure, if you marry her. Okay, can I have some time to think about it? Yeah, I'll give you 15 minutes. That conversation was on a Wednesday. By Friday evening, we were married. That path showed up really quickly, but I took it and I never looked back. The beginning of the road is really rocky. It's filled with uneven potholes, long distance troubles, but I'm thriving in my surgical career. So 2 years go by, and now it's time for me to move back to New York City to be with my husband, and the road gets even rockier. I'm living in America, and in order for me to practice surgery, I have to pass my medical licensing exams. I'm mopping floors on my first job back in the States at a Subway sandwich shop, and all I can think about is this exam. In Bangladesh, I was a superstar surgeon, but in the States, in order to practice surgery, I have to pass this exam. I'm just a high school graduate on paper. This exam is like this enormous fire breathing dragon, and I'm terrified. The heat of this exam is melting my armor. So I take the test and I get my test results back. It's not what I expected. I missed it by one question. Now, what am I going to do? My path just changed again. Hello, sunny Florida. I'm 26 years old, living with my in laws, and I'm trying out different careers, but nothing is making me feel worthy until this opportunity for health insurance. Health insurance, they didn't teach this in medical school. I have no idea what it's about, but I grab it. I take the opportunity and I dive in deep. In my second week of training, I'm handed this medical underwriting guide. Amy next to me, who's also training with me, is Googling and stumbling over words like cholecystectomy. It's cholecystectomy. It's indicated for cholelithiasis and sometimes some cases of chronic cholecystitis. It's like I'm reading Grey's Anatomy all over again, and I'm fluent in this language. And that's when I knew that my path just merged into the road that I was on. And I really stepped into my role when I started developing my personal brand. And that's when Dr. Noor, Healthcare Advisor, was really born. Since then, I've reinvented the customer experience journey for health insurance using my clinical, the value that I bring to the table is using my clinical know-how merged with my knowledge of global healthcare systems, how it works on a systemic level, and of course my health insurance experience and know-how. I'm able to make suggestions and offer customizable solutions for small business owners and their teams. And what I like to offer is really just leveraging your place of where you're at and offering solutions to tell you exactly what you need, but more importantly, sometimes what you don't need. I felt like throughout my journey, I've taken the road less traveled, but that's really the richness of life. So that's really my story on how I went from medicine to health insurance, and of course, how I can use my experience and knowledge to help you really make better decisions. So what I also like to share now, thank you for listening to my story. So when we talk about health insurance for business owners, there's really two main spheres that you can consider when considering your options. And I'll keep it simple by calling it option A and option B. Option A is going to be your state-sponsored federal marketplace. Now, each state has their own laws and some of them have their own versions of the marketplace. So it really depends on where you live. But when we calculate health insurance premiums, we're really taking into account two things: where you live and how old you are. So that zip code and age is really, really important to first talk about premiums. So it's hard for me to say or throw numbers unless I have a conversation to first figure out where you are, how old you are, where you are in your risk categorization when it comes to health insurance. When you're first starting out in your business, you're just at the startup phase, maybe funds are really, really low. Take advantage of that lower income in your startup phase. If you're a household size of one or a team of one, single member LLC or a sole proprietor, take advantage of when your business revenue is under $50,000 to take advantage of tax credits and subsidies that the government offers. So the government will offer a subsidized plan depending on where you live if you have an income or business revenue of under 50,000. But once you cross that mark, you're no longer qualifying for government subsidy. That's where option B, a plan on the private market, can really, really serve you well. So there's tons and tons of options on the private market. So it's hard to really say what's really good for you. And that's where I can come in as an expert to offer that evaluation, have a conversation with you to see, hey, where are you in your business? How are you doing with your health? What are your needs for medical insurance? What do you consider to be a quality health insurance plan? What would you love to have covered? Are you pregnant right now? Do you need, awesome maternity coverage? Those are some of the questions I ask to evaluate and then make a recommendation based on your situation on what health insurance plan on the private market is going to be good for you. I'd like to take a moment to talk about a specialization that I do in the private market space, and that's medically underwritten health insurance policies. This is a pretty well kept secret in the industry because this is the type of plan that instead of using your income to determine your premiums, we're going to use your good health. So if you're in the healthy and wealthy range, you're earning too much money to qualify for government subsidies, but you're generally healthy, you live a healthy lifestyle, you take care of yourselves, this is a wonderful plan option for you. And I'd love to talk to you about it to see if you'd be a good fit. One of the reasons I love it is because you're going to be saving about 20 to 30% in health insurance premiums compared to a guaranteed issue plan in the same bracket in the same quality of plan. So definitely reach out and have a conversation because if you think you're in this bracket, you can definitely benefit from such plans. So that's really the suggestion that I have for you, where if you're a growth phase entrepreneur, business owner, consider a private insurance plan that uses your good health. That way we can save you some money on that bottom line. I'd also like to talk about What do you want to do when you're growing and you're taking care of for your health insurance, but you're considering hiring your first employee? Super duper exciting, right? This is when you know your business is good and it's stable and you're ready to hire on some more help. Now, there's so many options here as well. Where are you going to do a freelance contract employee, a W-2 salaried employee? Lots of options there. Once you figure that out, the next question to ask yourself is, well, what kind of benefits can I offer to this employee? Or what do I want to offer? Maybe you're not at the stage where you can pay for the full premium amount for that employee. You can offer a credit or a stipend towards that insurance, which is a fixed dollar amount that you can offer, which can help with your budgeting as well for business expenses. Or you can offer maybe 50% towards that premium or 70%, whatever you like. One thing I do suggest that has worked out so well for me and my clients in my business is ask your employee what is important to them. What do they want for health insurance? When I have these conversations, I find that some employees, they don't care about vision or dental or life insurance. They just want really good quality health insurance. And when you have that knowledge and you can offer them exactly what they want, when you can offer your employee exactly the plan that and the benefits they want, they're so much happier. And as a small business owner, that helps your bottom line and revenue as well, because now you're not overpaying for benefits that they may or may not want. So I think it's always very healthy to have that conversation and set the stage. Ask them, have that conversation. And that's something that I love to do as well. When a business owner comes to me talking about, well, I've got 5 employees that I want to cover, what do we do? What are the options there? The first thing I want to do is talk to them. I would love to talk to your employees to first find out what exactly their needs are and then build a health insurance policy around that need. That way you have greater customer retention, you're saving money on your bottom line, everyone's all around really, really happy. So those are some of my expert tips that I have for when you're starting to hire your first employee as a small business, what to do for their health insurance. And as always, I really recommend a conversation with me so we can do that evaluation, do that help with that research with my extensive clinical knowledge, as well as my understanding of systemic global healthcare systems. I'm really able to offer and advise an unbiased opinion, expert opinion on what you should do for your health insurance.